First of all, why did we choose Tanzania? Infant mortality rate in Tanzania is 43 per 1,000 live births, which is about 1.8 times higher than the global average in 2018. Not only that, 400 children under the age of 5 die every day of preventable and treatable conditions in Tanzania. Therefore, our aim is to promote infant health outcomes and reduce the under-5 mortality in Tanzania. According to UNICEF data, increasing breastfeeding to near universal levels for infants could save over 800,000 children's lives per year, which is equivalent to 13% of all deaths in children under 2 globally. Studies have shown that breastfeeding can lower the risk of pneumonia by 47% and diarrhea mortality risk by 500% in developing countries. And as we researched on strategies to promote breastfeeding and infant health, we found 2 studies that had positive outcomes. In Garia study done in India, they provided pregnant women with a nutrient supplement containing 50 grams of sesame cake, 40 grams of jaggery, and 10 grams of oil during the 3rd trimester of pregnancy. At the end of the study, mothers in the treatment group had higher hemoglobin level and higher daily breast milk production than in the control group. In another study done in Vietnam, pregnant women were given a maternal milk supplementation along with a breastfeeding support program from the last trimester to 12 weeks postpartum. At the end of the trial, the intervention group had longer period of exclusive breastfeeding, and the children also had higher cognitive and motor development compared to the control group.
Mothers to Mothers is an organization that was created in Africa to cease the transmission of HIV from mother to child. The organization works by employing HIV-positive women as community health workers and peer mentors. Not only do these women work in health facilities, they also go door to door. Women of Mothers to Mothers educate and provide services and referrals for family planning, nutrition education, and HIV testing for expecting mothers. Peer-led, age-appropriate groups lead to better retention and adherence among clients. We will implement an intervention based on this model. However, we will have mothers teaching new mothers proper breastfeeding techniques and its importance in infant growth and health outcomes.
Our intervention will have 3 components, including the dietary supplementation and timing of the supplementation from the studies, and the support system used by Mothers to Mothers. First, we will provide dietary supplements that consist of sesame cakes, molasses, and oil during the 3rd trimester of pregnancy that will total in 30 grams of protein and 400 calories, a method that was proven to increase breast milk production and mean birth weight among participants in the Garia study. We'll also provide maternal milk supplementation during the last trimester and 12 weeks postpartum in the form of a Procter & Gamble fortified juice containing micronutrients including vitamin A, folic acid, vitamin B12, iron, and zinc. This method has been proven to lower the prevalence of anemia, but also increase longer exclusive breastfeeding. The support system will include mentor mothers who will go door to door in areas near health centers and administer supplements and educate pregnant and lactating women. This system includes community mentor mothers who are trained and educated at health centers and go door to door to pregnant and lactating women in areas nearby to administer supplements and educate women in supplementation and breastfeeding practices. They will also use digital services such as mHealth to track, follow up, and request services for patients. They are also a link to mentor mothers who work with doctors and nurses directly at health centers and link clients with access to services. Some of the advantages of such a combination include community. Services for people by people of the same community eliminate language barriers and unite women with shared experiences. There will also be increased compliance because the mentors are peers and have a better understanding of common social and cultural obstacles. Therefore, they build more trusting relationships with patients. Our intervention is also sustainable because it makes use of local health facilities and provides door-to-door services to improve access. The administration and distribution of supplements and support are also practical because mentors will be hired and trained locally.
Now we address the sustainability concerns of our intervention. Our specific combination of nutritional supplementation and the peer mentoring program based on Mothers to Mothers is specifically aimed at creating a sustainable intervention in Tanzania. Not only are we introducing a supplement to maintain generational stability of women, but we are suggesting doing so in a way that creates a comfortable environment for the women involved. In our strategy, we're focusing on our effort towards sustainable breastfeeding. To do so, we are providing nutritional supplements for pregnant women to support their nutritional status during pregnancy, while also preparing them for motherhood to maintain steady and healthy milk production. Thus, not only are we targeting mother nutrition, but the offspring's nutritional status as well. Breastfeeding in this way marks this generational transition state that can make obvious vulnerabilities in both. Not only does this encourage a natural process of development and less invasiveness on the part of the intervention into people's lives, but it promotes intergenerational women's health. As we had previously learned in Dr. Rasmussen's lecture, Female malnutrition tends to fall into a cyclic pattern from mother to child, and our plan is to target this specific phenomenon. Additionally, through the development of the peer support network progressively through the intervention, we are encouraging a strengthening of the local community and space to discuss various nutritional options and recipes, as well as a resource for aid in child rearing, especially in households particularly affected by disease. Most importantly, our nutritional supplement not only utilizes locally sourced products such as sesame, but also utilizes a recipe of sesame cakes that is common to the region. In this way, we are not introducing or changing much in the local environment and specifically focus on establishing more sustainable nutritional practices. As this intervention is meant to specifically create the sustainable environment rooted in boosting already natural processes, we are addressing it with utmost ethical consideration. Moreover, as a key element of our sustainable methodology is the peer support network. We are furthermore supporting any possible issues that may come about by creating yet another resource, especially in possible discomfort, speaking openly to clinicians or intervention officials.
Further research and development. A scoping review of maternal supplement program delivery methods in Bangladesh, Ethiopia, Kenya, and Nepal were examined. They concluded that lack of trained professional volunteers, limited support of volunteers, and high cost of equipment, supplies, and buildings stop mothers from participating in these programs. Our approach is to provide dietary and maternal milk supplementation, along with employed mother mentors to teach the importance and technique of breastfeeding. Because our design brings care to the clients by going door to door, mothers who cannot afford travel will be accounted for, and we will not have to pay for buildings. We also do not have to worry about the lack of volunteers and poor training because the mothers will be given jobs and trained in our health facilities. Supplies are cost-effective and locally sourced, making the intervention feasible. This intervention is also sustainable because it provides jobs and increases retention rates among students, which creates generational maintenance. The intervention is significant because the infant mortality rate in Tanzania is 1.8 times higher than the global average, and also breastfeeding decreases risk of pneumonia and diarrhea mortality. The intervention provides potential for expansion because it is easily replicable in places with local resources and mothers who are willing to work and share their knowledge.